The RENASYS AB Abdominal Dressing Kit with soft port is intended for use in conjunction with the RENASYS touch device and canisters as a complete negative pressure wound therapy system for managing open abdominal wounds with negative pressure wound therapy. RENASYS AB is indicated for temporary bridging of abdominal wall openings where primary closure is not possible and/or repeat abdominal entries are necessary. It's intended to be used in open abdominal wounds with exposed viscera, including but not limited to abdominal compartment syndrome. The use of RENASYS AB is intended for use in acute hospital care settings, trauma, general and plastic surgery wards, and should ideally be applied in the operating room. The use of RENASYS AB is contraindicated for non-enteric unexplored fistula, for untreated osteomyelitis, for malignancy in the wound, with exception of palliative care to enhance quality of life, when vital organs and structures are not covered with the organ protection layer, OPL, for presence of necrotic tissue with eschar, for use in patients with ongoing or high potential for hemorrhage and/or enteric leak. Foam should never be placed in contact with exposed bowel, arteries, veins, organs or nerves. Utilize the OPL at all times when using the RENASYS AB with the RENASYS Negative Pressure Wound Therapy System. Full device operation is found in the Clinician User Manual for the RENASYS Touch device. Further information is also available in the Help function on the device screen. Ensure that therapy is paused or the device is turned off. Remove the paper tape around the canister tubing and release the tubing to its full length. Open the canister clips on both sides of the canister. Position the canister so that the viewing window is facing forwards. Push the canister gently over the inlet port on the bottom of the device. Engage both canister clips. The canister clips will click when properly engaged. To turn the device on, press and hold the power button for 2 seconds. The touchscreen will illuminate and initiate the startup sequence. Remove the kit contents from the dressing pouch onto a sterile field. Organ Protection Layer OPL application. Warning: protect vital structures such as bowel and abdominal organs at all times during therapy with the OPL. Foam should never be placed in contact with exposed bowel, arteries, veins, organs or nerves. Either side of the OPL may be applied to exposed organs. If cutting the OPL to a different size, ensure that each piece removed is disposed of properly away from the wound. Ensure gloves are wet before applying the OPL to allow for easier placement. Gently position the OPL evenly into the abdominal cavity, distributing the sides into both of the lateral paracolic gutters. Any excess material on the sides of the OPL may be folded back onto itself. Size the foam to the desired proportions along the pre-scored perforations. If desired, the foam may be cut to size. This must be completed away from the wound site and the edges of any cut foam rubbed to avoid any fragments falling into the wound. Gently place the perforated foam into the wound cavity over the OPL. Ensure the foam is sized to loosely fit into the wound cavity and there is sufficient material up to the top surface of the abdominal wound. It may be necessary to stack multiple pieces of foam in deep wounds, depending on the profile. If multiple pieces are used, count and record the number of pieces used. Cover the foam with transparent film, removing the remaining adhesive panels to seal before removing the carrier panel. The film should extend at least 5 cm, 2 inches beyond the wound margin, and be securely anchored to the peri-wound to maintain a good seal. When using multiple pieces of film, ensure the edges overlap by a minimum of 7.5 cm, 3 inches. Avoid stretching or pulling the film to minimize tension or trauma to the peri-wound skin. Cut a circular opening, no less than 2 cm, 1 inch in diameter, in the center of the film over the foam. Remove any loose transparent film and dispose of away from the wound. Remove the adhesive panel from the soft port and align the port opening over the cut hole in the transparent film. Use gentle pressure to anchor the soft port to the transparent film. Smooth the dressing down while removing the soft port's top stabilization frame. To begin delivering therapy, set the pump to the desired pressure and press the Start Therapy button. Finished foam dressings should be leak-free and firm to the touch. Routine inspection of the negative pressure wound therapy device and dressing should include visual inspection and palpation of the dressing. The RENASYS touch device and system tubing should be positioned no more than 19 inches or 50 centimeters higher than the wound to ensure optimization of therapy and prevent therapy interruption. Note: when negative pressure is switched off, ensure the abdomen is adequately supported. Dressings should be changed every 48 hours or more frequently based on continual monitoring of patient condition. In the event of heavy or viscous drainage with sediment, infection, or when blood is present, more frequent changes may be needed. Check dressings regularly and monitor the wound to check for signs of infection, bleeding, or abdominal contamination. If there are any signs of systemic infection or advancing infection at the wound site, contact the treating clinician immediately. Carefully monitor patients for signs of bleeding, which may lead to interruption in therapy and hemodynamic instability. If such symptoms are observed, immediately discontinue therapy, take appropriate measures to control bleeding, and contact the treating clinician. Hemostasis must be achieved prior to dressing application. Carefully monitor patients undergoing treatment with RENASYS AB for signs of sudden or increased bleeding. If such symptoms are observed, immediately discontinue therapy, take appropriate measures to control the bleeding, and contact the treating clinician. For detailed product information, including indications for use, contraindications, effects, precautions and warnings, please consult the product's operating manuals prior to use. If you have any questions, please contact our customer services team on 08000 157 573 or email customer.services.uki@smith-nephew.com.